All right, so we said the blood cells in the hematological system are red blood cells, erythrocytes, white blood cells, leukocytes, and platelets, which are thrombocytes. And we talked about red blood cell disorders, and now we're going to talk about white blood cell and platelet disorders. So if you want a review of what they do, take a look at those optional lectures linked in Canvas. So different learning objectives. We want to be able to define leukopenia, leukocytosis, and leukemia, identify the key signs and symptoms of white blood cell disorders, understand thrombocytopenia and thrombocytosis, and recognize the clinical implications. Apply infection control principles for immunocompromised patients, and understand bleeding precautions for platelet disorders. So white blood cells, there are four different types: neutrophils, a front line of defense on innate response for the immune system; monocytes, which turn into macrophages, which are also essential in both the innate and adaptive immune system; basophils and eosinophils, which have other functions. And so when they do a CBC, which is a complete blood count, sometimes they'll do what's called a differential count, where they get the different numbers of the different types of leukocytes. And sometimes that can tell you what's going on. So if you have certain things going on, you're going to have elevated eosinophils, like allergic reactions. If you have decreased neutrophils, which is also called neutropenia, you are at more of a risk for infection. A lot of people who are undergoing chemotherapy or radiation have neutropenic precautions. The primary function of white blood cells, leukocytes, is to fight infection. So when white blood cell counts are abnormal, infection risk increases significantly. So we also have those lymphocytes, if you remember those, B cells and T cells, that are major players in the adaptive immune system as well. So leukopenia is not enough white blood cells, so too few white blood cells. It can be caused by HIV or AIDS, because HIV specifically targets, remember, viruses target specific cells, and they specifically target white blood cells. Chemotherapy and radiation can affect it. Nutritional deficiencies, bone marrow disorders, autoimmune conditions, or steroid therapy. So signs and symptoms of leukopenia: frequent infections, fever, sore throat, respiratory conditions, and slow healing ulcerations. So if you don't have enough white blood cells, you can't fight off those infections. PTAs need to observe strict infection control measures with leukopenic patients. And so vaccinations, hand hygiene, all the stuff we talked about in the last chapter, all that stuff. Leukocytosis is too many white blood cells. So higher than normal white blood cell count, it's a response to, most commonly, it's a response to acute or chronic infection. So when they do a differential count and they go, whoa, the white blood cells are off the chart, they figure that there's an underlying infection. The immune system is fighting something. That is, so sometimes if you have a viral infection, you can have leukopenia. Like, doesn't have to be HIV or AIDS, but any viral infection. And if you have a bacterial infection, you have leukocytosis. So doing a CBC can be a diagnostic tool to tell the difference between a viral infection and a bacterial infection. So besides immune system fighting something, other causes can be bone tumors, leukemia, being on corticosteroid medications. The treatment always addresses the underlying cause, because there's no specific treatment for leukocytosis itself. It's a description rather than being a disease. So with leukemia, you usually have too many white blood cells. An overproduction of immature white blood precursor cells crowd out the normal blood cells. So they don't just crowd out white blood cells, they also crowd out red blood cells and thrombocytes. So you're in trouble in a lot of ways. Usually the leukemia is classified as either lymphocytic or myelogenous, and acute or chronic. So acute lymphocytic leukemia or acute lymphoblastic leukemia, they're the same thing. is the kind that children usually get. Chronic lymphocytic leukemia is more common in older adults, as is chronic myelogenous leukemia. Acute myelogenous leukemia is more common in mid-age adults, not too young, not too old. The survival rate for leukemias has gone up so much in the last 20 to 30 years. It used to be a 5% survival rate. Now it's a 95% survival rate. So that is good. That is good stuff. The signs and symptoms of leukemia: bone pain because of the excessive production of the cells, fatigue and weakness because of anemia, because it's producing all those immature white blood cells and it's crowding out erythrocytes as well. Easy bleeding and bruising because it's crowding out thrombocytes. Increased infection risk because we don't have mature white blood cells to meet the infection. And enlarged spleen, liver, and lymph nodes because that's where the defective cells are broken down and recycled, basically. So they're working too hard. So treatment options: the primary treatment option for leukemia is chemotherapy, followed by radiation and bone marrow transplants. When you get a bone marrow transplant, they have to use chemotherapy to kill off all your existing bone marrow, and then you get new bone marrow. And you have to develop a whole new immune system. So it's like you're a new baby with new bone marrow, and you get a whole new immune system. Immunosuppressive medications are sometimes used in leukemia because it keeps the blood marrow from making too many immature cells. It's really important to know that patients undergoing leukemia treatment are at extremely high risk for infection. So you have to be super duper duper strict about hand hygiene and infection control protocols. Super important for people with leukemia. Platelets, their normal function, thrombocytes is their official name. Normal function is blood clotting. They clump together at the injury sites with other blood cells, and they create a physical barrier. That's the hemostasis part of wound healing. They stop bleeding. That's hemostasis. Normal platelet counts are 150,000 to 450,000 per microliter. If you have someone in the hospital who has 90,000 for their platelet count, don't take them out of bed. Don't take them walking. So too few platelets, thrombocytopenia, causes excessive bleeding. Too many, thrombocytosis, can cause excessive clotting or bleeding. So crazy, right? Crazy stuff right there. So thrombocytopenia is low platelets, and it can be caused by genetic disorders. You're just not making them. Nutritional deficiencies, liver failure, infections or sepsis, leukemia, or medications, blood thinners. Signs and symptoms: excess bleeding in the gums and mucosa, spontaneous nosebleeds, bleeding under the skin, petechiae, purpura, and ecchymosis. So petechiae are little pinpoint blood spots that are like purple or red. Purpura are little blobs of purple or red spots. And ecchymosis is like an internal bruise. You want to think of it that way. So you want to avoid activities where injury could occur. Even minor trauma can cause bleeding. So you need to watch for pressure from orthotics and prosthetics. Because even just like what you wouldn't even consider to be trauma in somebody else could cause bleeding for someone with thrombocytopenia. So thrombocytosis, also called thrombocythemia, which is a lot of thrombocytes in the blood. High platelets, you can have primary or secondary. Primary, you're born with it, probably. Faulty stem cells in the bone marrow, abnormal, they produce abnormal non-functioning platelets. It's idiopathic. It can actually cause bleeding, which is sort of counterintuitive, but you have non-functioning platelets, they're not going to do what they're supposed to do and clot. Reactive or secondary thrombocytosis can be from cancer, having a splenectomy. So you can live without your spleen, but then other things happen. Anemia, inflammatory diseases. So when you have secondary thrombocytosis, you have normal platelets, just too many of them. And sometimes there are no symptoms, but when you have symptoms, it can be weakness, bleeding, headache, dizziness, chest pain, and tingling in the hands and feet due to small clots. So, having too many or not enough platelets, both of those can cause excess bleeding, which is a little, and clots. It's a little counterintuitive, but there you go. So hemophilia is a genetic clotting factor disorder. So rather than something being wrong with the platelets, there is a chemical cascade that causes clotting. And if one of the clotting factors in that chemical cascade is defective or missing, it won't work. So the most common type is type A, and then there's also type B. It's an X-linked recessive, so that means males, since they have one X and one Y, if they have the gene, they have the disease. Females, if they have the gene on one X and they have a healthy X, then they will be carriers of the disease. So there you go. Lack of specific clotting factor is what causes the cascade doesn't work. You never clot, and even small bleeds continue. So it's common to have nosebleeds, bleeding gums, bleeding into the joints, which is called hemarthrosis, and brain bleeding, which can be life-threatening. So the treatment is to do infusions of the missing clotting factor, and most patients can self-administer those. So that's pretty handy. Um, and it's people are living longer with hemophilia because the treatment is easier now. So for infection control for people with low white blood cells, so leukopenia, hand hygiene, there it is again, appropriate PPE. If you're sick, then don't treat that person. Well, you should stay home if you're sick anyway, but monitor the patient for signs of infection and report fever or symptoms immediately. For low platelets, there are bleeding precautions. You want to avoid high-risk activities, monitor the skin integrity, be careful with orthotics and prosthetics because they're putting pressure on the skin, and watch for signs of internal bleeding and modify exercises as needed. So always communicate with the supervising PT and physician about patients with blood disorders and make sure you're applying appropriate treatment modifications.